Okay, we're live.
Good evening, everyone. I'm Kathy Turner, and I'd like to welcome you to a very special night tonight. We have a medical overview of our very outstanding treatment and our company. It's called Healthy Start by Orthotane. And for this, you are going to be receiving CE credits, which we're proud to have you a part of our program as kind of a first step and introduction to what could be a big part of your future. You're going to hear from a fabulous Dr. Amanda Wilson, who's one of our orthodontists, and she is in a very special place tonight. This is to learn a little bit about the ultimate phase 1 treatment. And why not? Because she's in Washington, D.C. And when the camera moves to Amanda, you're going to see that she's got a great view of what's going on there. And over the next couple of days, she's going to be working live from booth number 311, because this is the American Association of Orthodontics annual session that's going on there over the weekend. And Dr. Amanda is going to be speaking every day at 2 times, at noon and at 3 o'clock. So we invite you, if you happen to be in Washington and in attendance, that you come in and listen firsthand, hear this story, ask all the questions. You will be very impressed with what you're learning about and what it might mean for your future. Let me tell you a little bit about Dr. Amanda. She is a graduate of San Francisco CSF Dental School, then Master's Dental Science and Orthodontic Certification came from the University of Connecticut Health Science Center. She practiced then clinically for 10 years in the San Francisco Bay Area, so she's done thousands of orthodontic cases. She transitioned into corporate dentistry as a dental director consultant and a speaker, national and international, to both dental and orthodontic companies, recently in Thailand and Bulgaria. But for Amanda, it's children and early intervention that's the passion, because she recognized a long time ago that there is a void in the dental industry for orthodontics and early intervention. So now she is a clinical instructor for Healthy Start and Orthotane, and she is on a mission, like all of us, to create awareness about early intervention screening and treatment, because it will eliminate future necessity of costly, painful surgery and a great deal of exposure and risk to the patient. Currently, Dr. Amanda resides with her family in Honolulu, Hawaii. She loves to surf. She's great with the hiking. She's a Brownie and Girl Scout leader and a USA swimming official. She's also bilingual in German. I want to tell you a little bit now about our orthodontist, who happens to be a world changer. Now, if you have some questions this evening, you're going to be able to interact. You can go ahead and ask these questions online. If there's something sensitive or that you'd like to have a little bit more in-depth conversation, that you can go ahead and ask for that, and we'll get back with you by email. Of course, as I said, you have the CE credits, and so after Dr. Amanda is done with her portion, you're going to hear from Susie Lafredo, who's operating all the mechanical side of our presentation and our webinar this evening, and she will go over a little bit about what that next step would look like. And we certainly encourage you to hang for the end of this presentation, because you're going to have that information coming your way. Now, let's talk about our world changer. A board-certified orthodontist, this is Dr. Earl Bergerson, DDS, MSD, ABO, founder of Orthotane back in 1967. A year ago now, we observed and celebrated 50 years to what he has done for the entire globe with the number of children that have been treated. He's the inventor of the Healthy Start treatment system, and it is a system. He was also a dental school professor at Northwestern Dental School. We have treated over 4 million. I say we because I'll tell you, we internalize this. We have all got this passion and this mission of awareness. So 4 million children all over the world in 37 countries. He holds a lot of patents, the most prolific in the profession. He has 514 US and international patents. He's delivered over 500 seminars. He's been published over 80 times, peer-reviewed articles. He holds 80 monographs. The appliances that you're going to learn about tonight are unique in every way. They are FDA cleared, they're Health Canada certified, they're the equivalent of a Class 2 medical device, which means, of course, that it would be similar to a pacemaker to be implanted inside the body, that it is completely do no harm. In fact, it can do no harm, it can do only good things. There are no BPA, silicone, latex, and even the appliances in the cases that they come in are antimicrobial, ISO certified, and American made. So with that, I will say that Dr. Amanda Wilson will take over from here and share with you from Washington, D.C., and you will learn about what this orthodontist did to affect orthodontists and the entire dental profession, families everywhere, and the children are our future. He's making them healthier with beautiful smiles, and he's addressing all aspects comprehensively with permanent impact. So Dr. Amanda Wilson, please take it away on this great night for so many doctors to become informed and introduced to our great program called Healthy Start for Ortho-Tain.
Thanks, Kathy, and thanks to Susie behind the wheel driving the bus today. I'm super excited to have you all on the webinar today. As you can see outside, we are in the great district of Washington, D.C. There's the Washington Monument glowing behind me. Pretty excited. It is 9 p.m., so I hope many of you are still awake, and I know we have some doctors in Europe joining us. We have doctors on the West Coast, so really excited to kind of give you a quick overview of what we're going to be talking about at AAO this week. So let me go ahead and push play and get rolling on this. Hang on real quick. Here we go. All right, so the topic of our presentation tonight is going to be the ultimate phase 1 solution. So, you know, you may be thinking, well, I'm not doing phase 1, or I do phase 1, but I'm pretty happy about my phase 1, or I don't believe in phase 1. Hey, everyone has a different opinion about phase 1 right now. So let's just kind of look into it and hear about the philosophy of Dr. Bergersen, hear about his product. His phase 1 solution has been going on now for over 51 years. We're going on, I think, our 52nd year shortly. And there's been over 4 million cases treated. So that's pretty exciting. So we've got, I think we're in 43, 44 countries right now. I was really honored last week to have been in Bulgaria with the teams there. I met over 75 new doctors and existing doctors. Many of them have done hundreds, if not more, if not thousands of cases. Really great outcomes. I was just very excited. We've been in Bulgaria, I think, for over 20 years now and treating a big proportion of the population there. So let's go ahead. You've already heard a little bit about me. That's not that exciting. Let's go in. We talk a little bit about the ADA referendum that passed last fall. I think there's some updates on that shortly, but basically in a nutshell, it's saying that it's standard of care to diagnose and treatment plan sleep disorder breathing, or OSA, in your patients. You may or may not need to do that together with the physician, but with kids, it's a little bit different because they're growing individuals. And the sleep disordered breathing has everything to do with their malocclusion. And it often can be modified. So you can work on that malocclusion, you can work on those habits, and you can help diagnose and treatment plan SDB in your patients. So it's now standard of care. That means every single dentist or orthodontist, pediatric dentist needs to be doing this in their practice. So let's take a little quiz, okay? Which patient is ready for an orthodontic consult? Now, I asked these exact same questions in Bulgaria, and it was very interesting to hear their response. So the options are A, B, and C. And all the Bulgarians, well, the ones that are already certified said A or B, and the ones who weren't said C. So I'm asking you, feel free to buzz in. You've got your raise your hand at the bottom, so I can see if you come up and we can address your questions, concerns at the end, but buzz in what you think is best. Well, the right answer is actually all of the above. A, B, and C are all ready for an orthodontic consult. That means pretty much every patient in your waiting room, as long as they have some type of teeth, are ready for an orthodontic consult. Now, if they have only gums, they don't need an orthodontic consult, whether they are 6 months or 102. If they do not have any teeth, they do not need an orthodontic consult. But if they have any teeth, they need one. That includes baby teeth. So you really much should be consulting every single patient in your practice. And that's pretty exciting. That makes it really easy to know which patients to screen because it's every patient. So your front desk should be able to handle that. So the next question is, which patient will be more compliant? A, B, or C? Same patient. And again, many patients think it's C, but really from my experience, it's A and B. They're the easiest patients, and most orthodontists can tell you that they'll take a younger patient any day for compliance over an older patient. There's less attitude, they're excited, they want to be there, they want to please, and honestly, it's simpler than you think. And the cool thing about Healthy Start is the compliance is really built right into the process. The compliance is built into the appliance. We take compliance and make it easy breezy for you. And we'll go into that a little more later. So we've already had the introduction to Dr. Bergerson. 1967 was the invention of the initial product, what started initially from a positioner to help settle your braces case, turned into the Healthy Start system, which is now actually, correction, it's 4 million smiles created since 1967 through a series of appliances to help equilibrate the occlusion, help balance the occlusion, help to interdigitate the occlusion, expand the arches, and eliminate habits. So that's what we're here for. And every single child has a different specific scenario that we need to address. So the series of appliances may be unique for each appliance. What are some of the root causes? What are some of the things that a Healthy Start appliance system addresses? Well, basically, we're going to say that there's 9 different ones. And I'm going to go ahead and read them off, not because you can't read, but because some of you might be in the car. Some of you might be streaming this while you're putting your kids to bed. So I want you to hear what the system does so you can kind of internalize it all. But number 1, it expands the dental arches when they need to be expanded. That doesn't mean we're flat out expanding every patient. It means that when it's needed, when they need the space, we're going to go ahead and expand them. Number 2, we're establishing nasal breathing. If any of you have ever had an ortho patient who's a mouth breather, you know that your outcome is going to get unraveled. So we're going to go ahead and establish that if it's not there, okay? We're going to train the tongue to swallow appropriately, correctly, in the right spot, and to also sit in the right spot when it's not swallowing. We're going to eliminate any bad habits. And often, you don't know that your patient has bad habits until later it comes back to cause trouble at the end of your ortho case. So habits can be anything from digit sucking, thumb sucking, tongue position, lip sucking, sucking on a stuffed animal. So many habits, mouth breathing. We got to get rid of them all. And you might not even know they're there. So why not just go ahead and address them all at the beginning and get rid of them at the onset and really reduce any problematic things from occurring. Number 5, we're going to open the airway by advancing the mandible if it's needed. We're going to correct any malocclusion, and there's many malocclusions out there. We're going to encourage proper facial and body growth, reduce future relapse, and provide proper cusp-fossa intercuspation of the dentition of all 28 teeth. That's a lot, right? Who wouldn't want all that? So another little quiz for you. Are you waiting too long to address oral habits in your patient? Think about that for a few minutes. Now, we've all seen some of these crazy mousetraps that we're putting in our patients' mouths, and many of you think that's the only option. Hey, I've placed plenty of mousetraps in my lifetime, not knowing that there were other options out there, thinking and just assuming that my patient wouldn't be compliant, but not even giving them the benefit of the doubt that maybe they would be, and maybe there's removable options out there. Sure, fixed appliances are not going away by any means, but give your patient a chance to wear something removable. I always think now that my kids are older, and now that they're my patients, or they're our patients, would I really want to put that in my kid's mouth? How many orthodontists would say yeah to that? How many pediatric dentists would actually put that in their own kid's mouth? Sure, if it was a last resort, maybe. But would that be the first appliance you put in your own kid's or your kid's friend's mouth? It wouldn't be mine. So, does it work? Yeah, but is it a positive patient experience? No, there's other options. Are undiagnosed oral habits coming back to haunt your cases? Hey, this has happened to me many times. I'll be the first one to admit that there's so many times that I missed an oral habit. It might be on your patient questionnaire. It may be on your medical history. It may not be on your medical history. Or it might be, and they weren't truthful. They maybe didn't understand the why. Why do I need to stay if I'm a thumbs up? Who cares? What does this have to do with straightening my teeth? They may have no idea. Or the parent may not even know, whoever filled it out. So you'd be surprised how many kids are sucking their thumb under their pillows, under their blankets, in their closet. It's a very shameful activity. So we need to find all those oral habits so they don't unravel your case when you take the braces off or the aligners off. Since we're talking about habits, let's go in and talk about kind of the hallmark, the first appliance in many situations of our series of appliances, the habit corrector. That is everyone's favorite appliance, I think, if you had to pick a favorite. There's a lot, but the habit corrector I know is my favorite. It's the one everybody wants. And you need to be a Healthy Start provider in order to be able to prescribe this appliance. And basically, it's a really cool appliance with literally, I think over 100 patented features into it to correct the bite and to do many of those 9 things that we said that we were going to address with the Healthy Start Appliance System, from expanding the arches when needed to eliminating habits. So how long is a patient going to be in a habit corrector for? Well, it really depends on the patient and if they have habits, and that's a pretty common question. If they have habits, they may be in them until the habits go away. If they don't have any habits that you know of, then they may be in it for a month or so, just to expand the arches if it's needed, or just to make sure and to ensure that the tongue is swallowing correctly. Hey, none of us are perfect, and we all have a little bit of oral habits. I mean, sometimes I feel like, I lisp a little bit, and maybe there was a habit that wasn't fully corrected. Hey, we all have something. So let's go ahead and wear that habit corrector and get everything tip-top shape before we get started. And the cool part about the habit corrector is in 77.4% of the cases, it expands the arches up to 4 millimeters when needed, so that fixed expanders aren't needed. And who'd want one if you didn't have to have one, right? So these are some of the features of our habit correctors. There's all sorts of modifications that are built in depending on the child's bite. It's a deep bite, it's an open bite. Okay, if they have weak lips, we need to increase their lip strength. All sorts of different modifications that you can build in depending on what you're looking for. And we will teach you all these modifications when you take the training course. And speaking of the course, let's go ahead and talk about that. How do you become a Healthy Start provider? We're going to talk about it a little bit more at the end, but just want to let you know now, because some of you are probably asking and you maybe don't want to wait till the end of the course to find out how to become a provider. So there's a couple different options, and it really depends on you. Depends on the urgency of how quickly you want to become a provider. Some of you want to become one tomorrow. And basically, we have 3 primary options. The most classic one is the destination course. We've got plenty of those all around the world. I was just in Europe last weekend in Bulgaria training doctors, and we trained tons of them. So it was pretty exciting. We had a great time. We also have plenty around the United States. Pretty much every week or two, we have a course somewhere. So often sold out, so make sure you sign up in advance. Number 2, you can join our new digital course. We've been doing those now. We're going on our 2nd year of doing the digital courses about every 2 months. We go ahead and start it. It's a series of 6 different classes where we go ahead and you watch some instructional videos initially. Those are dispensed out on a Monday. You finish your reading and the prescribed assignments. And then we're going to follow up with an optional study club that's on a Friday. And you can go ahead and join in and collaborate with all the other doctors and submit cases, talk about cases. And then you also get access to a private forum where you can go ahead and post your cases and get started. And with that digital course does come 2 free cases. There's an extra bonus to taking the digital course. So you can go ahead and get started, and you are allowed to go ahead and start your cases the first day you sign up. Of course, we're going to be there to support you. You don't have to wait till you finish the course to get started on the first step of your cases. So that's pretty exciting. And we'll go ahead and send you those initial appliances while your cases get worked into the diagnostic system. The last option is the full-on, I would call it not digital, but I'm just going to call it webinar-only course. There's no, I wouldn't recommend this one unless you're like in a hurry to go and get it all done this weekend, But there's still some doctors who want to get it done within 24 hours and are willing to sit 18 hours in a row and get trained. So, there are quiz questions, but if you really, really want to do it, we do have an all webinar base. The prices are all the same. Okay. So, obviously the best deal, 2 options. The best deal is probably the digital course, because you do get the 2 free cases with that. And you also get a voucher of $3,000 towards a destination. So it's a double dipper right there, basically. So you're getting, I think, double the CE units plus 2 free cases. But that's a limited time situation. I can't tell you if we're still going to have that in the fall. We're kind of just dabbling it out right now. So I believe the next course is starting. Susie will let you know, I think, shortly in a few weeks. I think maybe in June, the next course is starting. We're already in week 4 of our existing course, but you can go ahead and sign up for that. We talked a little bit more about habit correctors. What can they do? They correct everything we talked about: tongue thrusting, abnormal swallowing patterns, mouth breathing, resting tongue position, thumb and finger sucking, open bites, overjets, flare incisors, speech problems, mandibular underdevelopment, and narrow palates when needed. Okay, these are some of the modifications. We were talking about the over 100 patented features on the habit corrector alone. Now you got to compare apples to apples, okay? Apples to oranges. So when you go to AAO, there might be some other functional appliance companies that may or may not be in the exhibit hall. Hey, I'll be the first to admit, often imitated, never duplicated. So when you've got a good product, people are going to try to copy it. What's the difference? These features are patented. They can't have any of these features. So they might have something plastic that kids put in their mouth, but they can't do all these things and train the tongue and do this. So you're not going to get the same outcome. You're just not going to get there, and you're going to figure it out at the end. So also think about what you're going to put in your patient's mouth or your own kid's mouth. Would you want to put silicone in their mouth? Would you want to put something that wasn't medical grade material in your mouth? I use them on my own kids. I certainly would not put something that was questionable in my own kid's mouth that's a plastic. We all know all the side effects that can come up from plastics, whether it's BPA free or not. There's so many other components that can leach out of plastic. We know for certainty that these products have been out here going on their 52nd year. There are generations that have been raised on them, and they're healthy and happy. And many of them are instructors and clinical instructors for the system. So, and now their kids are going on it. So I feel 100% safe dispensing this to my patients or to my own kids. And I think you can too. This is ISO certified medical grade plastic produced in the United States. Here's some of the, malocclusions that you may see that would be good malocclusions to start a habit corrector. Remember, we're starting young. We're starting at as young as 2 sometimes for habit correction. So it's an easy appliance that can sub out for a thumb or finger habit. When you start to see that mouth breathing, when you start to see that tongue thrusting, or any of these early symptoms that may arise, you can go ahead, and that's why we call it interceptive treatment. We're going to go ahead and get started today, tomorrow. As long as the patient has teeth, we're going to go ahead and get started. That doesn't mean we're moving teeth yet. It means that we're eliminating habits in the little kids. Once they start having permanent teeth, we can worry about that. Here's a really, really nice case. It's a habit corrector only case, okay? But I want you to really see, doesn't mean every patient's going to have this result, because I want you to see the power of the habit. So when you actually remove the habit, look how quickly the body adapts and starts to straighten up on its own, okay? So that's why we have to remove the habit. Airway. We talked about STD. We talked about sleep disorder breathing and how it's now standard of care. You need to understand airway in your patients, all your patients. Doesn't matter if you're an orthodontist, you're a general dentist, you're a pediatric dentist, you need to understand airway. You need to understand why airway is important. You need to understand how to screen for airway. And the good news is our class will go ahead and teach you how to do that. And when needed, you may need to refer to an MD, and we'll help support you on that as well. We'll also tell you a little bit about medical billing and how you can navigate that system. And it's complicated, and that's not something I specialize in by any means. But we will connect you with the right channels for that. But you do need to understand and idealize airway and how to diagnose and treatment plan for this. How to screen, what's a normal airway, what's an abnormal airway, what's a small airway, what's an ideal airway, what's proper breathing, what's improper breathing, what's not right. Snoring, mouth breathing is never okay in kids. It never is. It goes ahead and it pushes that mandibular even more down and back, the mandible more down and back, blocks the airway even more. And it does not get better. Little kids, these 2-year-olds, these 3-year-olds that are mouth breathing, our studies show that it does not get better with age. It's just going to keep happening. It's a habit. Make sure if you're taking Ceph x-rays, you need to start reading your Ceph x-rays. You need to start looking at the airway, looking at the adenoids in your x-rays. And then also you can even simulate what happens when they're mouth breathing, if they're mouth breathers. Look how much smaller that airway gets. Look down here, the simulation. In some situations, they're only just a millimeter or 2 open. That is way too small of an airway to be open. So how do most orthodontists diagnose and treatment plan airway and disorders in their kids? Well, they may not be. And that's why we're here to teach you. But it's really important that we talk about all these symptoms. And I think when you first see this list of symptoms, these 22 symptoms that can occur when your child is having airway issues or sleep disorder, breathing, or even just habits, it really kind of blows you away because you start to see trends. And it's not going to present the same in all kids. There's going to be kids that have 2, 3, 4 symptoms, 1 symptom, 22 symptoms. And these children that are having multiple symptoms, it is not a good quality of life. And you may have had no idea that this was connected in any way with orthodontics. This is connected in any way with dentistry. This is connected in any way with malocclusion, but now you do. And once you see it, you can't unsee it. So take a look at this list of symptoms and start thinking back to these patients. Are you even screening for this in your office? Are you screening for patients? Are you, as a dentist, screening for these? Are these in your medical history? Are you incorporating this into your process? Probably not, but you will after today. And the great part is that our sleep questionnaire can be integrated easily, and we'll teach you how to do this into your regular paperwork, whether you want to do it online, whether you want to do it, manual, attached to the medical history, however you want to do it, but you want to start screening for this. What is the root cause of all these symptoms? Well, often it's mouth breathing or sleep disordered breathing or sleep deprivation, and everything is interconnected. What can start as simply as just extended bottle feeding, passive use, tongue position, abnormal swallowing, a really soft diet, and now, not well-developed musculature, or, the basic mouth, the size of the mouth, habits can turn into airway reduction of the volume, reduced oxygenation, which can cause that whole myriad of symptoms that we saw. And like I said, it's not going to present the same in every single patient, and it may change over time. So you need to be aware and have those 22 symptoms in the back of your head. So let's ask another question. Is oral hygiene compliance a recurring nightmare in your practice? If you are an orthodontist, or even if you're a general dentist, you see plenty of patients with braces, and sometimes it's bad. There's a lot of plaque, they're not able to brush around it. There's recurrent decay, decalcification. Hey, some patients are great at brushing and flossing, but how much of your time is spent lecturing kids about oral hygiene? How much of your staff time is spent lecturing kids about oral hygiene? What is the value on your time? If you can't give me a number right now, my doctor hour, my overhead for my doctor, my chair time value as a doctor is $2,200 an hour. And my staff, Susie's chair time, or, Jenny's chair time is worth $95 an hour. You should have that answer. And think, in an average day, how much time does Jenny spend lecturing a kid or teaching them or sending them back to brush again? Maybe she spends 55 minutes during the day. And maybe I'm sure you spend at least an hour and a half during the day on an average ortho day lecturing patients about oral hygiene. Having that conversation over and over again with the patients, documenting it in your chart, telling the parents that they need to step it up, or you're going to have to remove the wires or do an early debond, telling them that they need to go see the dentist for a cavity check, delay taking the wires out so they can get fills done, so that they can get oral hygiene taken care of. This takes time. What if you don't need to do that? Why do you always need to do that? You don't necessarily. Braces, we know what they are. Yeah, in some patients, you're going to have to use them, but not in all. And we're going to go ahead and have you think outside the box. So we're going to be talking a little bit more about eruptive guidance versus external sources. What's the difference? And what I explain to people every night, every day pretty much, I explain to people, what's the difference between the Healthy Start Appliance system and traditional braces or aligners? Well, it's totally different. Because the difference is you're not placing a force on a tooth that's already erupted. You're guiding a tooth that is in the process of natural eruption. You're guiding, not forcing the tooth to go in the right place. It may have gone in the right place anyways, but we know where the right place is, right? We know what the arch width should be to get everything to fit. Why is there more crowding? Why is there more malocclusion now than there was 50 years ago, 100 years ago? It has everything to do with habits, industrialized society, softer diet than our primitive ancestors had. There's studies and studies and studies supporting this. Our children are not eating hard table foods anymore like they did 100 years ago, 150 years ago. There was no baby food. They didn't grind everything up. You ate the food that your parents ate, and you just found a way to eat it. You went from breastfeeding to eating table food. There was no intermediate step with puffs and baby food and Gerber, aisles and aisles and aisles of this. It didn't exist. And guess what? Kids got along just fine. So somewhere in there, we've made a mistake. And that year or two, and in some situations, 5, 6, 7 years, these children are still eating toddler foods. And that is what is causing more malocclusion, together with the pacifiers and the habits and the bottles. So our bodies weren't meant to do that. We're causing these problems on our own kids, and you can prevent that on your kids and prevent that from happening. But in any case, eruptive guidance, we're guiding the tooth into the right position. It already has its own force, its own natural force at the speed of its own tooth. So if it was naturally going to go this way, this way, this way, we're just going to give it a gentle reminder to go that way. And it goes in straight. All the child has to do at that young age is just wear it at night. And if it's a really aberrant tooth going some weird way, they might need to wear it an hour or two while they are in the car, or while they're getting ready, or they're gaming, or they're watching TV. It's not hard to find that hour or two per day, okay, and kind of chew around on the appliance a little bit. It's fun to chew on. But in any case, if you start early, when the teeth just start coming in, you can pretty much eliminate almost every possible malocclusion out there. And there's a few one-offs. And the one-offs are basically going to be some type of skeletal malocclusions that are just going to happen because of genetics anyways, like your skeletal open bites, you know, VMEs, skeletal class 3s, there's going to be some, you know, and I don't recommend it on syndromic patients, and I don't recommend it yet. You know, some people are using it on clefting, but it's not recommended by our team because there can be complexities that come up with it. But in any case, I would say if you're starting when the first tooth comes in, you can definitely use it on probably 98 to 99% of your patients. That's pretty cool. It's a lot of patients. So, hey, we know we can predict into the future, right? We can predict who's going to have straight teeth. We can predict who's going to have crooked teeth. I can take a look at a classroom of 2-year-olds, go to a preschool, and line that up and say, you're going to be crowded. You're going to need probably 2-phase treatment. You might not need braces. Hey, you're going to have extra gaps. We know that sweet spot is about that 6 millimeters in there. That's the sweet spot. Anything less than 6 millimeters of spacing in the deciduous teeth means that you're going to most likely have crowding, and the chance of that and the prevalence of that goes up with the less spacing that you have. And 6 millimeters is a sweet spot. Usually you're really good with 6 millimeters spacing. And if you have more than 6 millimeters spacing, you're going to have extra spacing, which is not necessarily a bad problem. That's an easy problem. But in any case, we want to be there, right? We want to be at that 6 millimeters. If we're not, let's get us there as soon as possible. And then sometimes you're going to have Bolton discrepancies and other little, you know, derivations and deviations that are going to occur. But there's certain things we can do to encourage the teeth to be straight. Of course, diet is in there, you know. What else? Habits, eliminating them as early as possible is in there. There's some other preventive measures. We can teach you all about that in the class. We could probably spend 2 hours on this. But basically, in a nutshell, malocclusion research, there's tons of articles out there. If you want to see some of the articles, please do go to thehealthystarts.com, click on providers, click on research. We have a library in there with lots and lots of articles. We're always updating it, putting the latest, greatest ones in there. And if you want to find something and it's not in there, let us know. You can email us at info@thehealthystarts.com, okay, or contact@thehealthystarts.com, and let us know what you're looking for, and we will find it for you. We have team members who literally specialize in research. They're always reading because our system is so broad. I mean, like I said, we're about habits, we're about diet, we're about sleep disorder breathing, we're about OSA, we're about tonsils, we're about adenoids, we're about, you know, overbites and underbites and overjets and, you know, cross bites, and we're about everything. So we do a lot. So we have to know everything. And it's a lot of reading, but it's really, really fun. So in any case, but basically in a nutshell, what do we know? Malocclusion gets worse with age. Spacing improves with age. Overbites usually get worse. Overjets kind of stay the same. They can get maybe 2 millimeters worse. Negative overjets or underbites, those will get worse, depending on if it's class, you know, if it's maxillary retinopathy or mandibular advanced, then it kind of depends on the situation. But we can pretty much get that crystal ball out and we can predict exactly where that kid's going to be in most cases with, you know, starting at age 2. So with that knowledge, you should feel empowered to go ahead and screen the 2-year-olds and on, and feel confident to tell the parent what's going to happen. Here's our options. Here's the risk, benefits, and alternatives. Here's what we can possibly do now to be preventative measures. Parents are really into preventative measures. if you're telling them, I'm sorry, yeah, you're going to need 2 phases of treatment. And by the way, I can't start till your kid is 7. They're 2 right now. Now they're free, but get your house in order. Go ahead and get your insurance. That's all I can tell you to do. They need to lose, get me at least 8 permanent teeth in first and the 6s, or I can't do anything. How would you feel as a parent if someone told you that? I mean, I would be crying in any case. So, what am I going to do? I got 5 years before you can do anything. You telling me habits, get rid of them, give them stickers? What do you want me to do? So, and I love talking about habits. And I have to share a really fun one with you that I learned this weekend in Bulgaria, because I love asking in every country I go to, how do you get rid of habits? And I don't think Kathy and Susie have, or even our CEO have even heard this story yet. So I'm going to go ahead and you'll be the first ones to hear this story. So in Bulgaria, 2 different ways to get rid of oral habits that you've never heard these before. Number 1, put this on our list, have grandma knit a pair of itchy gloves with the most scratchy yarn that's out there. This is great. Okay, most scratchy yarn that's out there, and sew it to their pajamas. Sounds terrible. Who wants itchy gloves on their hands and they sleep with it and it's itchy and they don't want to put it in their mouth? Funny though. I like it. I'm going to use that one. I thought I heard them all. Number 2 is, this is classic. Get some big glass jars or bottles. Big glass jars, like a juice. I don't know. In Europe, they have these big, long, elongated juice containers where they have orange juice, and it's kind of like cylindrical and about maybe 18 inches, 12 to 18 inches, and the aperture is maybe about 4 inches, maybe 3. You definitely fit a little kid's hand in it. Put their arms in the giant juice bottles and then duct tape it to their arms and have them go to sleep with 2 giant glass bottles on their hands. Yes, you heard me. That's their suggestion on how to hey, that's ingenious. I never ever thought about that. If all the stories I heard in us and our hot sauce and our Malvala stops, we don't recommend any of this, but positive reinforcement and stickers and shaming. Hey, that's awesome. Hilarious. I can't imagine my kid going to sleep with 2 giant jars on their hands. But in any case, I just wanted to share that tip with you. If you have any other tips, please do. And I'm going to go ahead and toggle down. Give me your tips in the questions here. Tell me your habit elimination suggestion. Personally, I recommend the Healthy Start Habit Corrector. Much more positive experience. But, if the jars work for you, go ahead and use that. Okay, indications for treatment. We have for kids, for preteens, for teens, adults, different indications for treatment. This is just a guideline. There's one-offs, It doesn't mean if your patient or your case is harder than this, you can't take it. There's all different ways to work around for this, but just want to kind of show you basically what it comes down to in a nutshell. If you've got a young patient, less than age 7, only maybe lost a few teeth, we can pretty much take almost any case. And I told you the one-offs, the skeletal cases earlier, but that's pretty cool. That should give you a lot of hope. You should feel very confident recommending these series of appliances, these EGA appliances. A lot of them are really fun. They're comfortable. Like we said, they're VPA free. They're ISO certified, medical grade plastic, made in the USA, et cetera, et cetera. So you should feel comfortable prescribing this. And we're going to teach you about this series of prescriptions, and we're going to support you with coming up with a recommended treatment plan for the child. So you can go ahead and have that series of appliances. And of course, you're the doctor. So if you want to tweak the prescription, if you want to tweak the series of appliances, you're more than welcome to. We're going to tell you what each of them does. And then from there, you're going to get a recommended treatment plan. If you decide to take it a different direction, so be it. Every doctor is different. Maybe you want to use glass bottles on their arms. I don't know. Okay. So speaking of that, is the growth modification solution in your practice a positive patient experience? It may not be. Are you still doing headgear? Hey, headgear works. I'd full on say it works. But would I want it in my kid? Nope. Have I put it in many kids? Sure, because it works. But if they wear it. But hey, if I can get a kid to wear headgear, I'm pretty confident I can get a kid to wear a really comfortable plastic appliance at night that doesn't hurt, They can sleep any way they want. They can sleep on their face. There's no restrictions. Nothing's pinching, nothing's cutting, nothing's poking. I almost have 100%, track record on getting kids to wear funky appliances. So if I can do that, you can definitely wear a Healthy Start appliance. So, but you know what? Do the parents go ahead and blog and share on Facebook how much they love the headgear you gave their patient? No, they don't. They don't do that. So, because it's not fun and they're kind of embarrassed about it. And is a kid going to wear that at their sleepover? Probably not. Are they going to bring it to camp? Probably not. There's a few one-offs on that. But in any case, no, this is not a positive experience. So we talk about your growth modification solution, the Healthy Start appliance system. There's articles after articles after articles. There's entire countries that are using this system. Like we said, 4 million cases, showing that it actually does produce mandibular growth. Hey, there's lots of different appliances out there, lots of different systems. Some of them work better in the late mixed dentition. Ours work better in the early dentition. So early mixed dentition, that's how ours work. And that's what the studies show. So that's why you need to start early. And remember, you need to learn to analyze the skeletal growth in your patients. You need to know where they are, where their dental age is versus where their skeletal age is, where they fall in the middle. You need to treat accordingly. And that may mean that you're doing one appliance now, something else later. But that's the beauty of the Healthy Start appliance system, is you can go ahead and start everything early and just guide the teeth into where they need to be and optimize the growth. We talked about different countries that were doing research. We have this series of articles that measure the cephalometric outcomes as well as the clinical outcomes, called the Finland research papers. We do have some synonyms for the Healthy Start appliance system. At some point, it was called also Occlusa Guide, Night Guide, a couple different words you may see in some of our research articles. We have rebranded it. All these other features that are in the research are built into the new series of appliances. So they're all built in. We just rebranded the whole system as a Healthy Start appliance system, not unlike other systems that are out there that have been rebranded that may have subcomponents in it. But in this research, they do talk about Occlusa Guide and Night Guide. But in any case, what the outcome of this research basically said is they took entire town, in one town, basically, all the kids within that parameters was treatment. And in another town, which was like nearby, all the kids within the parameters were control, okay? So, and they had T1, T2. T1 was when the first tooth came out. T2, it wasn't an age. It was until they get to this point. So it could have been 1 year, it could have been 2 years, it could have been 3 years. T2 is when 2 to 2s were in and 6s were erupted. Average treatment time was 3.3 years. I know you're thinking that sounds like a lot of time to do this phase 1 treatment, but you're really only seeing these patients every couple months because they're just wearing this thing at night. So the actual amount of chair time is limited to none. And they're just kind of growing with it in. So it's really, really easy. Malocclusion parameters were overjet, overbite, crossbite, crowding and spacing. So pretty much a lot of patients in that kind of T1, T2 zone. But basically what it showed was that crowding almost all eliminated. And these are the kids that were compliant. And it's pretty easy. Our compliance rate is high, just because we incorporate all this fun stuff into the system. And we'll kind of briefly go over that. But, open bites corrected, overbites corrected, overjets corrected, showing that the actual amount of kids that needed treatment later means needed phase 2 treatment was 1%. In some cases, somewhere between 1 and 10% actually needed treatment later. That's amazing. That means between 90 and 98% didn't need, depending on the malocclusion, didn't need phase 2 treatment. So that's pretty neat stuff. So, hey, I'm not trying to take away your braces patients at all. That's the last thing I'm trying to do. I'm not trying to take away your treatment. I'm trying to create more treatment for you, okay? There's always going to be those retreatment cases. There's always been people that lost their retainers. You've got generations and generations and generations of this still going on. So really, as an early adopter of this, and I'm not going to say early because we're going on our 52nd year, but as if you aggressively adopt this, you're really getting to double dip in my mind. You're double dipping on all the retreatment cases, all, the regular comprehensive phase 2 cases that you need to do, as well as you're getting first dibs on all these younger patients. So pretty cool. You could do very well. Because remember, you're screening all the patients between 2 and 102 that have teeth. So neat stuff. Nighttime exercises. Remember we talked about the often duplicated, excuse me, often imitated, never duplicated systems that may or may not be out there at AAO. Remember, our system does not require nighttime exercising, our system does not require daytime exercising. The nighttime exercises are built into the appliance system. That means while the child is swallowing X amount of times at night, you're always swallowing, you're exercising while you're sleeping. Hey, I wish I could exercise while I sleep. That would be fantastic if I could get my entire workout in while I slept. But yes, the kids do their workout. They do their homework, their mouth homework while they sleep. In most cases, if it's a very complicated case, like I said, or they're starting later than ideal, you may need to chew around on it while you do your homework and watch TV, but that's not too hard. Compliance indication. I told you compliance was part of the process. It's super duper fun. Couple different options in there with the compliance indications, but basically we have our compliance app and doctor dashboard that's built in. You can go ahead and download it right now if you want. You can go ahead and go to the Google Play Store or the iTunes Store. You can go ahead and download the Healthy Start app. It's green and blue. It looks like that too, so you're going to find it. You will have limited access. You'll have public access to it if you do that. That means you won't be able to use all the features, but you will get to see, and I'm going to take you on a quick preview of it. I'm going to turn down the volume so you don't have to hear the narration of it, but I'm going to go ahead and play that. Oops. And we'll go ahead and kind of show you some of the stuff that you'll see. But basically, in a nutshell, it's going to take you into the app, okay? You're going to have the ability, it's not playing. Let's go. Okay, so you're going to go into the app, lots of cool stuff in there. This is the full series app where you can go ahead and go in there. You can log in as a patient. The doctor has access within your own portal. You're going to be able to communicate with this patient and see all the things that they're posting. You can go ahead, you can go in, you can chart your compliance, you can get, I'm just kind of showing the visitor center there, all the stuff you can see, getting your basic information. You can go ahead and you can chart your compliance. You can say, I wore it, I didn't wear it, I wore it for so much, I didn't wear it for so much. And from there, you can basically get virtual wooden nickels for your wearer. You can redeem your wooden nickels. I'm calling wooden nickels because we call them that in ortho, but you can redeem them for all sorts of prizes. We'll go over that. This is the sleep questionnaire. You can go ahead and fill out an initial sleep questionnaire if you're a new patient. If you're an existing patient, you can check in and fill it up over time and check in and see how your symptoms are doing. The doctor will have access to that, which is neat. Like I talked about the wooden nickels already. You can take your wooden nickels. You can go ahead and play video games with it. You can earn screen time. You can also check in. You can record a little YouTube video, and you've already signed your social media release earlier. It's part of our package. You can record it. You can share it with your doctor. Then they can go ahead and share it on Facebook. So there you go. There's some promos for you. You can take pictures showing your updated progress, which will go into the doctor dashboard. You can also earn your wooden nickels. If you don't want to do video games, you can go ahead and stick it in the bank, or from the bank, you can go ahead and go shopping with it once you earn a lot of stuff. So pretty neat stuff. I think you're really going to like it. Only our providers can get this, and only when you're entering your cases actually into our portal, and then you'll get an activation code for your patient. If you enter their contact information, they can go ahead and activate the app. So highly, highly recommended, really cool stuff. And by the way, they can also leave reviews, which you can use, and always get your social media release and photo release signed. So I love it. Good job. Our app has been going out now in the second year now, and everyone's having fun with it. Minimum overall treatment chair time. The average Healthy Start patient only has 2 to 3.5 hours total chair time. And I know you're thinking, what? Didn't you say that treatment took 3.3 years? Well, yeah, because we're not applying an external force on the teeth. We're going at the gentle rate of the patient's teeth that they move on your own. But what are you really doing? Yeah, maybe we're switching out some appliances occasionally when needed, but they're not really gluing anything to the teeth very often. We're not really doing anything to the teeth. They're basically sleeping in this appliance at night. So they're going to come in. It's going to be kind of like an aligner check-in every few months. They're going to come in most cases, you're going to check in. You're going to rah. You're going to give them a prize for being really great. Maybe, maybe not. You're going to talk about the app, remind them to wear it. Hey, you're awesome. And how much of that is really doctor chair time? Minimal to none, very little. Most of the doctor chair time is really occurring at the diagnostic check, and that maybe, it's about 30% of the overall chair time. So you can do the math. It's 2 hours, 30%, figure it out. It's not that much. What is that? 40 minutes. So, I mean, and that's pretty much what it is. I mean, obviously you're going to do your check when you come in. Hey, how are you doing? You know, and then the assistant does, you know, progress pictures or charting, checking things, you know, documenting. Pretty easy, but easy stuff. You know, you should have a value on your chair time. Your staff should have a value on their chair time. And that's why the ROI in this system is really good. And speaking of all this, speaking of money, are you discouraged by high lab fees for removable appliance systems? I know I am. Cool thing about the Healthy Start system is that we really pride ourselves, and I don't know that people often say we're underpriced, but that's part of the value of Dr. Bergerson. He believes strongly that the lab fee should be low enough that it should be hopefully something that's accessible by every doctor. It's not becoming an elitist system, and hopefully every patient around the world. It's something that can be affordable in every country. So if we keep that lab fee as low as we possibly can, maybe, I always say, you know, do we have a $1 billion marketing budget? No, we don't, because we choose to spend the money on the product and on the value. And that's just, I'm just speaking for the, you know, Dr. Bergerson and the corporate team, but that's really their value. Okay. And I think it's a really honorable value. And that's part of the reason why myself and I think Kathy and Susie and some of our other team members really enjoy working with this team, because truly I can tell you that every single member of this team truly either uses the product or believes in the product and thinks it's extremely important, you know. And if you talk about, you know, the importance in your life, thinks it's an amazing system out there, and was really proud to be a member of the team. So you know, we stand behind our product, and you know, we share it, and we just really give great testimonies about what it's done and what it's done for patients. So lab fees low. That's kind of the range of where it's been. Maybe it's a little bigger range, but definitely under the $1,000 mark for a full system. So, and how you choose to bill it, how you choose to do it, whether you're using dental billing, you're using cash, you're using medical billing, that's your own thing. We can give you support on that. What you want to charge depends on what you're using it for. Are you using it for phase 1? Are you using it for comprehensive? Are you using it for phase 2? Are you just doing habits? What are you doing? I don't know. So how you want to bill it, that's your own thing. That's not our job. We can't tell you how to bill it, but we can give ideas. That's all we can do. Retention. This is another ROI that's kind of built into it. How many patients do you see as an orthodontist who are retreat cases? They lost their retainer. I mean, I know I've had braces multiple times. I can tell you stories of retainers getting broken, lost, stolen. Go to college. How many kids lose their retainer the first term? Go to camp, they lose their retainer, they break their retainer. Everyone's got stories. You basically need to build that into your overall fee for your braces as a parent, because it's going to happen. And retreatment is probably going to happen, and parents get frustrated. But the cool part is when you start early and you expand those arches and you start to guide the teeth in nice and straight, and the teeth actually think that, you know, the PDLs and the collagenous fibers, they have memory. And when they come in straight, they actually think they were straight, even they maybe weren't predisposed to be straight, but because they came in straight and you guided them in straight to begin with, the memory says they're straight. So really, there's very little to no relapse. Couple situations, if it's a really big overbite, yeah, okay, those tend to come back. So we may have them stay in their last appliance for a little bit longer, or maybe indefinitely, one night a week till they finish steadily growing. Not a big deal. Easy. And matter of fact, many of our patients love to stay on their last appliance, and that's totally fine. They sleep better, they feel better. It reminds them to nasal breathe, not mouth breathe. I have tons of stories about this, but in many cases, they discontinue the treatment and they go away and they don't wear their appliances anymore and they stay nice and straight. And we have 52 years of proof behind this, that it's completely different than how braces work or how aligners work. One more little perk about the ROI, the treatment setups are done, or not done, but the computer that does the setup. Well, let's say the final checkoff, there's a final checkoff that occurs not by a technician in a foreign country, but it's done by US licensed dentists and orthodontists who are familiar with the system. Pretty cool stuff. You can feel very confident that there's always one eye on your treatment plan, somebody thinking about it. And the recommended records that go into this are pretty comprehensive. It doesn't mean you have to submit everything that we recommend, because ultimately that's your treatment plan. This is your diagnosis. You know, if you don't think something is necessary, then that's your choice. But we just strongly recommend the full set of records, which can include, depending on the age of the patient and the symptoms, SEFs and or a cone beam, a pano, models or scans, et cetera, et cetera, et cetera. Photos, intraoral photos, a sleep questionnaire, and all that. So all of that comes in. There's a lot of thought that goes into every treatment planning. This is little kids. It's really important that we get it right the first time. So I think that's a huge ROI. Let's take a look at a few cases. I'm just going to kind of breeze through them. You know what's good, you know what's not good. You can kind of get an idea of how some of our doctors are using it, whether they're using it for phase 1, they're using it for comprehensive. You can see some of these longitudinal cases where they didn't have retention. They come back 10, 15 years later. Everything's nice and straight. Occlusion is really sucked in. Really great class 3 case here. Really great for pseudo class 3. Corrects it as an alternative to that kind of face mask therapy or a Frankel. Just really corrects it quite quickly if the patient wears it at night. Neat stuff. And we have stories of some pseudo class 3 patients that correct their pseudo class 3 and is quick as a weekend. They literally just wear their appliance all the time, which we're not saying you have to do. But if they really want to knock it out, there's some patients that have done that. And that's how quickly a pseudo class 3 can correct. And we know it's magical. And the parents think you're amazing when you correct one of those, because it's dramatic, right? Functionally, it's dramatic. Aesthetically, it's dramatic. It's neat stuff. And you've got to get those pseudo class 3s corrected as soon as possible, because we know all the terrible things can happen if you don't. This is a neat crowding case here with the high laterals. We know this will be very tricky in aligners, trying to grab it. Laterals they're troublesome with aligners, but easier in braces. Look how nicely it goes ahead and pulls them down. There's nothing bonded on the teeth. All we're doing is using the elastomeric material to go ahead, grab under an undercut, and bring that tooth down. This is a really nice overjet overbite case. There's a backstory on it. The mom had orthodontic surgery. Really nice correction here. Overall longitudinal correction, follow-up, really, really nice overall outcome. So open bite cases that were corrected, really nice cases, really great outcomes, longitudinal follow-ups. Crowding cases, no retention follow-up. Overjet, overbite, and crowding cases. Overbite cases, follow-up, no retention. Overbite and overjet cases. You're going to see a lot of these because it's just really magical on these types of cases. Overall, I think this is another overbite, overjet case. Very nice. Again, we come to the conclusion of our program, but 4 million cases have been treated. I think we're in about 43 countries. All appliances are regulated class 2 medical devices, ISO certified, no latex, FDA approved, no plasticizers, over 500 plus US and international patents. I'm going to go ahead and give you the contact information at the end, and I'm going to pass this over to Susie, who's going to go ahead and tell you a little bit about getting certified for the system. All right? Have a great day, y'all. Thank you.
Awesome. Thank you so much, Amanda, Dr. Amanda. I'm going to play a really, really quick whiteboard video. If you guys can just stick with me just for a couple of minutes. It's a 1-minute video. At the end, I will show you guys how to earn your CE credits as well. So give me 1 sec.
Have you heard of Healthy Start? Orthotain, our parent company, just celebrated 50 years of helping close to 4 million kids around the world improve their health. Through the Healthy Start oral appliance system, we take orthodontic approach to treating children with sleep, breathing, and airway issues. The Healthy Start appliance system is soft and comfortable, like pillows for the teeth. Non-invasive, non-pharmaceutical, FDA cleared, American made. Our oral appliances promote natural growth and development of the dentition, but beautiful smiles are just the beginning. The Healthy Start system addresses the root cause of sleep-disordered breathing, promotes nasal breathing, while discouraging mouth breathing, widens the dental arches, helps to develop the jaw, all while straightening the teeth, just like nature intended. Unfortunately, research shows that 9 out of 10 children face one or more symptoms of sleep-disordered breathing: headaches, difficulty in school, snoring, bedwetting, night terrors, chronic allergies. To name a few, these symptoms can lead to lifelong health problems. The American Dental Association's new policy states that it's the responsibility of all dentists to receive education on how to assess and treat airway issues. Healthy Start to the rescue. Get digital training, earn CE credits, online, at your convenience, from the comfort of your home, anywhere in the world. Want to know more? Visit www.openairwaydentistry.com or call 844-KID-HEALTHY. Don't wait. Healthy Start changes lives, and so can you.
Awesome. Thank you so much. So one of the things that we are really excited about, and I know Dr. Amanda touched on this in her presentation earlier, is our digital education course. And I'm going to tell you a little bit more about it. You know, I'm sure by now you already have children in your mind that you are thinking that need help. That have these symptoms, children that are coming through your practice that, Healthy Start can help them. So our digital education course is great because you can take it from anywhere in the world. And we actually do have a course that starts on Monday, June the 4th, and it does include hands-on treatment of 2 full cases. And I'm talking 2 full cases, not just the starter appliance, but all of the appliances that you need for that full case for that child. And it includes a diagnosis, the appliances, the animal cases, so everything you need. There's a $3,000 voucher included towards a destination course in 2018. And we always encourage that you invite your staff members to not only attend the digital course, but also up to 4 staff members can attend the destination course using that voucher as well. We have our interactive study groups, and these are great. Love the study groups because it gives us a chance to interact, to ask questions, but we do record everything. So even if you can't make it on, we will make sure that you have the recording. It says on here the first study club starts tomorrow, but that's not the case. It actually starts on Friday after the initial course goes out on June the 4th. You would receive training on pediatric treatment of sleep-disordered breathing, improper facial growth and development of the dentition, screenings for sleep breathing and airway issue, increasing patient flow, and you'd actually receive 18 CE credits for this course, and then an additional 16 CE credits for the live course. And it's great because it actually complements the new ADA policy on sleep-related breathing disorders. And as the ADA states, it is the responsibility of each doctor to get educated on airway. So we've had some great response to our course, and here's just a few. And again, we do have doctors from all over the world who take our digital education course. So we had a doctor from Australia. He said that the digital course was excellent. All at Healthy Start have really got their act together and offer resources others strive for but rarely achieve. Well organized, passionate, and supportive. Doctor from Canada said, "I want to thank you and your colleagues for this amazing course. I've been searching for a solid system to help my patients, and this is by far the best, most organized, comprehensive course I've taken." And then we have a doctor in Colorado. She says, "I've really been enjoying the course, and we have identified quite a few patients that will benefit from Healthy Start. My business partner's 4-year-old is in the habit corrector because he has had a swallowing problem, and we've already seen great improvement in his eating." And this was just a short amount of time after wearing the habit corrector. We already have 3 more patients who are ready to start next week. And keep in mind that she sent this testimony in just 3 weeks into the course. So these kiddos, they already had patients lining up. And then, of course, ADA, American Dental Association, said that the Healthy Start digital education course is ingenious. And that's high praise. Okay, so how do you get started? How do you take advantage of this? There's several ways. The first is, of course, you can call or email us. We have 844 Kid Healthy, and we also have an email address that you can send us an email if you'd like at contact@thehealthystart.com. You can register tonight, and if you do that, as Dr. Amanda was saying, we will send you your starter appliances immediately so that you can get started. Those habit correctors, again, you can start treating your children, these children now. So we will send that to you. There is an investment of $3,400 for the course, but that includes everything that I talked about, including those 2 free cases and the $3,000 voucher. So basically, you start making money off of this course immediately. If you want more information, this is my email address. You can actually click to screenshot this if you'd like, so that way you have this information. Or you can register electronically by visiting www.openairwaydentistry.com. And as you can see, there's plenty of call to actions on that page. So you can visit and you can sign up right now, and we would love to have you as a part of our course. So CE credits, how do I get my CE credits? Well, your CE credits will actually be emailed to you within a couple of days. But if you have any questions at all, again, here's our contact information and our website. So please, we're here also if you have any questions, if you'd like to use the Q&A, and if there's anything that we can answer for you, we'd love to answer any questions that you have now. If not, that's okay too. You can always, as I said, you can always email me, and I will make sure that your questions get answered. Dr. Amanda, is there anything extra that you'd like to add? I mean, Dr. Amanda is getting ready to present at AAO. She's going to be doing many presentations in our booth. So if you're around, come by and visit the Healthy Start booth.
For sure. Please do. We're both 311, 311, kind of like 911, but 311. So come by. We have an awesome location at noon and 3 o'clock on Saturday and Sunday. We're going to do mini lectures. If you let us know ahead of time you're coming, we'll save you a seat. We have a few seats, but if not, you can stand up. But in any case, yeah, we'd love to see you. Stop by. Please introduce yourself. If you're in another country, hey, that's all right. Just message us. We'd be glad to talk with you. We really are open at providing any type of conversation with any doctor who has any concerns or questions. We do have a link that you can go ahead and use to schedule a conversation. If you have a conversation with one of our doctors or with myself, maybe it can be in the follow-up email that Susie can send. If when you get your things, you can go ahead and schedule that. We've had some of the doctors take advantage of that for AAO already. So yeah, we're just excited to connect with you. And I think that's one of the cool part about Healthy Start is that there's so many resources. And then don't forget, I don't know if Susie told us, but we do give you access to our forum, our Facebook forum, which is private. There's one for the doctors in the digital course, which is separate from the actual providers. And you can go ahead and post your cases, post your questions. And I can pretty much tell you, I don't know if we have the stats on this, but I think the response rate is within a matter of an hour. So yeah. One of our doctors is going to respond, or one of our team members is going to respond. And I think it's just like amazing peace of mind. You're sitting here, you're in another country, or even in the US, or you're like me, you're completely on the other side of in the ocean, and you got a case to show, and you're like, gosh, I hope someone is awake, no one's picking up the phone, and you post it and you get an answer and you feel really good that you have support. I mean, remember, you have a network of thousands of doctors and 4 million cases all around the world. And they're all using it slightly differently and in their own way, but the resources are there. And I think you can feel really comfortable that you're part of a team.
Absolutely. Absolutely. Thank you so much, Dr. Amanda. Thank you so much, doctors, for getting on. And we really, really appreciate it. This has been recorded, and I will send this out to everybody sometime or another this week. I'll make sure it's out. So thank you again, and everybody have a wonderful night.
Thanks, Kathy, for your introduction. All right. Have a great day.
Bye-bye.
Or great thing, depending on where you are. Okay, bye.